the general view is that there are probably 5 big programs that we need as a partnership to focus on. One is on primary care, particularly on how we embed primary care networks and their capabilities and skills into the work we're trying to achieve in neighbourhoods. How we also modernise the primary care estate. We've had a good long history with our local authority partners in establishing resource flows to allow us to modernise primary care facilities, and that we'd want to continue that work because that's pretty critical to how people are going to experience care in the future. And creating a new focus on what people can do in terms of continuity of care. So we hear a lot from primary care about that trade-off, that handoff between secondary and primary care. We've tried to build those interfaces much closer together. I did a big piece of work when I started in the NHS on mental health in primary care. So trying to make sure that people who access mental health services in a secondary care setting could move to a primary care setting and have their needs met in a really expert, effective way in that setting. So there's more work we can do across the pathways in primary care, and particularly thinking about the agenda that primary care networks, Harin and others that are on the call, are trying to get a grip on currently. The second big theme related to children, young people, maternity and families. Big shout out to Honor Roads for the families bit that now appears, I hope, almost everywhere. But it is pretty critical thematically to what we're trying to do in City and Hackney. So I'm going to major a little bit on this in the next few slides or next section, but it is fair to say that it feels to us that children and families will bear possibly the burden of the pandemic in the main. Children partially from the exclusion they felt from schools and the isolation they felt at home, but also from what they now perceive. And I sit on a number of roundtables at London, along with Phil and others. They feel like their opportunities have been diminished. They will not have the same life opportunities that pre-COVID generations had because of limited input in terms of education and limited opportunities in terms of economic recovery. So there's a massive gap, I think, emerging in children and young people's health more generally, which I think we will need to use all of our collective instruments and our wits to try and mitigate. And we're going to, as I said, major on that in one of the next sessions. Neighbourhood and Communities was a pre-COVID initiative. We've been working diligently on establishing this now for possibly well over 3 years. We're fortunate that our primary care networks map against our neighbourhood teams. They will be the conduit through which that model that I've described earlier of people working in a neighbourhood setting around patients with different roles, working within a primary care context, providing multidisciplinary support to people in their neighbourhoods and close to their home, is going to be our future. That is the plan. It's in the long-term plan, which we've already submitted, and it's in our plan that we've been working on over the course of the pandemic. So it's hugely exciting, I think, to have at least that foothold built in structurally to how we organise ourselves and our work. The fourth big theme related to rehab and independence, particularly about making sure that people were supported to their homes quickly. So that links to the conversation we had earlier around discharge and moving people quickly from hospital to a setting of care in their homes and in their community. This is also going to be pretty critical in terms of how we reduce the waiting lists and use a different set of inputs potentially to people on waiting lists now that could be waiting 12, 18 months from now to have a surgical intervention. So we will need to have a really different think about how we support people in terms of their maintaining their independence at home, and use technology differently, but also inputs differently. So I'm doing a piece of work with a really inspiring consultant, orthopedic surgeon, working in Barts actually, who's exploring how mental health inputs for people experiencing pain who are on a waiting list for an orthopedic surgery, how their outcomes can be affected positively by having a psychological intervention to support them manage their pain differently. So I think we will need to be doing much more of that kind of thinking when we get into really working through the detail of this program as we mobilize it. And in mental health, we've seen Again, a thematic shift in terms of the burden of the pandemic, with both people's life opportunities in jobs being diminished, but also a significant spike in suicides, particularly in City and Hackney, which we need to understand a bit clearer. But we've also had some really positive innovation come from this, with personal health budgets for mental health, where people were getting a budget to buy a mobile phone, to have the data on there that's networked into the crisis line, that has their care support workers number, that has access to their GP. And the feedback we've had has been phenomenal. And in fact, it's up for one of the HSJ awards tomorrow night. In 4 of the categories, it features as an exemplar that should be held nationally. So that programme of mental health, rehab independence, neighbours, communities, children, young people, maternity and families, and primary care will of course be supported by a set of enablers, amongst them now 2 new enabler groups, population health, to try and focus on inequalities and make sure everything we do has inequalities at its heart, and a VCS enabler group to pick up on Jake's point about the VCSE being part of the family of service provision and the suite of public sector resources that we make available to our residents to help them live and improve their lives. So we'll come on again, as I said, to some of those. Thinking of it as a team really about, I suppose one might describe them as big ticket items. What are the things that we feel we should really be focusing on collectively, along with all the things I've mentioned previously in the previous slide, but really what are the kind of top issues that we should be focusing on? And where we've got to, I think, is 3 major themes. One relating to discharge, which I talked about earlier, and I've explained why I think discharge is important, because it maintains independence, but also frees up capacity in hospitals for us to manage people on waiting lists. But I do think there's a big programme that we need to articulate around mental health and children and young people. That, as I said, is where the burden of the pandemic is most likely to fall, listening to the feedback that we've heard both regionally and nationally from young people who, as I said, feel hugely disenfranchised by the context that we're in now. The third kind of big ticket item that we wanted to test out with you was carers. And there's a sense that, considering there are a number of people now on long waiting lists, and they will remain on long waiting lists for quite some time, I fear, considering the economic climate that I think is ahead of us and is going to be bleaker, and we'll know a bit more about that as we enter into summer recess time about where the comprehensive spending review looks. But there is going to be a burden of need on families and on people who care for people informally in their settings of residence. And I think we need to probably really think about carers, and this is on the next slide, Alex, if you could, to begin to think about the partnership between the paid carers workforce that we can see and then the unpaid carers and families that we don't always see. And I think that's a real opportunity for us to think about putting our City and Hackney values onto carers, children and young people, as a way of supporting discharge and making sure the system is sustainable and works for the future. So I just wanted to leave those 3. There's a slide on the next one, Alex, in people's pack that talks about some of the wider context of children and young people, which shows population growth over from 1992 through to 2019 and onwards. There's just a growth in our under 15, 16 to 24 year olds, 16 to 64 year olds. So the population of young people is going to grow in City and Hackney. We know that. So I do feel it, along with carers, is probably something that we should really put our collective minds on as a big ticket item for the future.
Operating within a crisis is slightly different than getting back to a different way of working. And I think one of the things that we need to be really clear about is we're now building something different, and that will be more expansive and needs to involve a wider range of people. And as Honor's already mentioned, a number of parameters that previously we've worked with have been absent over the past 12 months and will return over the course of the next sort of 12 to 18 months, if not 6 to 12 months. So we will need to think about that as well. But I guess in periods of such crisis, you can go in one of two directions. You can either start letting anxiety create divisions, or you can pull together. And of course, typically what we found within City and Hackney is actually people very, very strongly pull together. So all of the foundations that have been laid over the past 3 to 4 years, particularly by David and his team, are now really there to be built on. And I would echo what Jake said about David's involvement in this, and I was very keen that David presented the slides on behalf of both of us, but this is really the start of something, but equally it's a recognition of how we've managed to get to this position, and that's not just in the last 2 or 3 months, but it's in the last 2 or 3 years.